Hello health champions! In this video I want to go over some of the signs and symptoms of the coronavirus and how they compare with and contrast to some of the other common ailments like colds and flus and allergies. I also want to cover some unique characteristics of the coronavirus to help you avoid getting it, but more importantly to help avoid spreading it. Coming right up. Hey, I'm Dr. Ekberg. I'm a holistic doctor and a former Olympic decathlete. And if you want to truly master health by understanding how the body really works, make sure you subscribe and hit that notification bell so you don't miss anything. It's certainly easy to get paranoid during a pandemic like the coronavirus outbreak. We're just finishing up cold and flu season and we're heading into allergy season. So millions of people are having symptoms anyway. But what do they mean? Well, here are the most common coronavirus symptoms. They're not necessarily how severe they are, but it's the frequency. So 88% of people who get infected are going to have a fever at some point. Not necessarily so much in the beginning, but it would develop over time. Dry cough is going to be experienced by 68% of people. And these two are the big characteristics of the coronavirus. Then we have things like fatigue and wet cough that get about a third. We'll get those. And a wet cough is also described as sputum production, as opposed to a dry cough where it's just kind of irritating. A sputum production or wet cough means that things are coming up out of the lungs. Shortness of breath, muscle pain, and joint pain. Now we're getting down to about a fifth or a sixth of people. Sore throat, headache, chills, less common, and quite uncommon are things like nausea or vomiting, nasal congestion, diarrhea. And with the nasal congestion also sneezing is kind of rare, and that's one of the things that set this apart. So what about kids? Well, the symptoms are going to be the same, but for the most part they are less severe. Kids get away pretty easily for the most part. However, when they get it, they're the same, so they get the same fever and the cough and even respiratory distress in severe cases, even though they're fewer. Something to keep in mind though is that even mild cases are contagious, that you're just as likely to give it to someone else even if you are not as harshly affected. Kids not being so aware of the importance of this, that's just an extra reason to limit their activities and keep them away from other people. So let's take a look at how the symptoms compare across some of the more common ailments. With corona, you're going to almost always have a fever. With a cold, it's going to be more rare. With the flu, you're going to almost always have a fever. And with allergies, it's going to be rare. The dry cough is something that is quite common with all four of them, but even more so with the corona and the flu. So cough is not a discerning factor. You're going to have that pretty much in all of these. Shortness of breath is very characteristic for the coronavirus, but more so in the more severe cases. As the infection progresses, you can get a secondary infection which causes inflammation and fluid buildup in the lungs. And most people who die from the coronavirus die from acute respiratory distress syndrome, meaning the fluid builds up to the point where there's not enough available surface area, dry surface area in the lungs to exchange oxygen and carbon dioxide, and now they basically drown. The cold and the flu are not going to have shortness of breath or respiratory distress. And allergies, however, can have that, but it's not going to be the same mechanism. You're going to react to pollen and environmental stressors, not have the respiratory distress because of fluid buildup. When it comes to aches and pains, they do happen with coronavirus quite a bit, but even more so with the colds and the flus, and hardly at all with allergies. So the first three are infectious agents, whereas allergies, again, you're reacting to the environment. Same thing with sore throat. That follows the same pattern, that you're going to have it with the infectious agents but not with the allergies. What about a runny nose? A runny nose is quite rare with corona, which is surprising to most people, but the coronavirus has receptors that affect the lungs specifically. So with colds and flus, you're going to have lungs and head congestion, but with the corona, you're going to have pretty much neck down. It's going to be lungs primarily. So the colds and the flus are going to have quite a bit of runny nose, especially the cold, and also allergies. You can get very congested and runny nose. Sneezing is virtually absent with the corona. It could happen, of course, if you breathe in some pepper or something, but as a result of the virus, it doesn't really happen. The cold also has very frequent sneezing, whereas with the flu, it's kind of rare, and with allergies, it's extremely common. Let's take a look at how the symptoms overlap. If you have cold or allergies, then you're going to have itchy eyes, cough, runny nose, and sneezing. And if you have those primarily, that's a good sign that you don't have the coronavirus or the flu. Corona versus the flu is a little bit harder to differentiate because they do have fevers and chills. They do both have the cough. The difference is going to be primarily on the shortness of breath in the COVID-19, and it's going to be that the flu also affects the head, the chest and the head, whereas the COVID-19 is primarily the chest. Another difference is that the COVID-19 is going to have a slower onset and progression typically, whereas the flu is pretty much once you get it, you wake up one morning and it's there, it's overnight. Now let's talk a little bit about why is the coronavirus, why is COVID-19 so bad? Why are countries shutting down? Is it all the deaths? Not really. Even though the death rate is significantly higher than the common flu, than the regular flu, it's about, depending on the age group and the category, it's between 4 times to 20 times more deadly than the flu, but it's still a small percentage. So that's not the reason that we should be concerned. That's not why they're locking down borders. The reason is something called R0, which is a value that talks about how easily it spreads. So if R0 is 1, that means that for every person who gets infected, they're going to transmit it, they're going to infect or contaminate one other person. And if that's the case, then the disease neither shrinks nor grows. Okay? It stays the same. That if we have 100 people, then they're going to get well, but before they get well, they're going to infect another 100 people. If it's less than 1, then the infection is going to peter out and die on its own, because for every person who gets infected, they're going to infect less than 1, so it's never going to take off. If it's a little bit more than 1, now even a 1.1 or a 1.2, that's still pretty serious, because now that means that the infection will increase. There will be more and more people. There is an exponential growth, even if it's very slight. So with the flu, we have an R0 of 1.3, which is still pretty bad, and that's why these influenzas spread. However, with the coronavirus, the R0 is 2.0 to 2.5. And that may not seem like an astronomical number, but it is pretty huge, because this means a doubling exponential function. That means for every person who gets it, they're going to infect between 2 and 2.5 people. So instead of having a growth rate of 1, 2, 3, 4, 5, 6, 8, 9, 10, 12, we have 1, 2, 4, 8, 16, 32. So it's doubling. And that's why you see these growth curves getting really, really scary, shooting pretty much straight up. That's the number one reason why this is so scary. Another factor is that They're not quite sure, but it seems like the incubation time, meaning the time between when you get contaminated, when you get infected with the virus until you start developing symptoms, is 2 to 14 days. That's quite a long time, which means you can go for up to 2 weeks being infected, spreading it to others, and not knowing it. For the flu, that number is much, much lower, between 1 to 4 days. You know much faster if you're infected, so you don't have the chance to give it to as many other people. So even though the death rate is higher than the flu, it's not anywhere near that of Ebola or SARS or anything like that. But the spread characteristics is what makes this so serious. I know you've heard this before, but I'm going to tell you again. Protect yourself, wash your hands, and wipe surfaces and objects frequently. Everything you come in contact with, anything that other people come in contact with, wipe it down as often as you can, because the virus on your skin won't harm you, but the virus inside your body means you're infected. So even if you get it on your hands, even if you touch things, if you wash carefully and frequently, then you can wash it away and not get infected. The other thing that's really difficult is don't touch your face. And what they have found is most people touch their face every 3 to 4 minutes throughout the day. It's subconscious. We're not aware of it. It's just something that we do. Maybe it's a little itch. Maybe we're just supporting our head. But we touch our faces all the time. And the areas you want to avoid is mouth, nose, and eyes. If you touch those areas and you have the virus on your hands, then you are likely to get infected. So if you think that you did get it, now what do? Well, you stay at home. You isolate yourself, you avoid contact with people, you avoid spreading it. And why do you stay at home? Well, for a few reasons. The first one is that 80% of cases are mild. You don't need anything to get over it. You're going to get some symptoms. You're just like a cold or a flu. Your body's going to fight it off and you will get better. The second reason is that they can't really do anything for you. All right, there is no treatment for most viruses, period. And for this one, because it's so new, especially, they don't really have anything to do for you. The only time that they can help you is they can help you with breathing if it gets to that point. And also, of course, you want to stay at home to avoid spreading it to others. But what if it gets worse? What if you're not in the 80%? What if you're in the category that gets worse? Now is when you call a doctor, because now you might get to the point where you will need some help, but you can also have someone to consult with that can tell you the correct steps to follow. And the reason you want to call your doctor is if you get shortness of breath. That would be an indication that you have a secondary pneumonia, that your lungs may be filling up with some fluid and that you're reducing that air exchange surface in your lungs. If you have persistent pain or pressure in the chest, that would be another sign. If someone in your household has a confusion that wasn't there before, or if they're sleeping, or if they're sort of nodding off or losing attention, you can't get them to arouse, can't get their attention, that would also be serious signs. If their lips or face are turning blue or bluish, that's another sign. All of these things indicate hypoxia, that your body is not getting enough oxygen. Now here's the main thing to understand. The death rate is relatively low. It's been estimated about 1.4% recently. So this is not so much about you as it is about others. If you're reasonably healthy, you'll probably be okay, but you could still spread it to others. So the death rate recently has been estimated to about 1.4%. And depending on the age group, the younger age groups have about 0.2% death rate, whereas people over 80 years old have about a 15% death rate. So if you're young and healthy, you're going to be okay most likely. But it doesn't mean that you can't spread it to others. Another feature is that some people have such a mild infection that they're asymptomatic. They don't even know that they have it, but if they have it, they can still give it to others. And if you add the fact that the incubation period is as long as 14 days, then even people who eventually get sick, they could walk around for 14 days and infect others. So some people kind of have the attitude of damn the torpedoes or yippee, it's spring break. We really want to change that mindset. We really want to change that way of thinking. I believe it's very irresponsible for the young people to go on spring break and say, hey, look, my death rate is 0.2% or lower and I'm probably not going to get it, so I'll be fine, because those same people will probably, a lot of them will probably contract the virus and then take it home to their families and give it to their parents and grandparents who might be in this category. So it's not about us, it's about everybody, okay? It's not about the individual, it's about locking down the spread so that we can contain this. But most importantly, don't panic. We want to take this very seriously. We want to understand that it is a crisis, it is a pandemic, but we also want to understand that we will probably be okay as long as we contain it and don't give it to others. If you enjoyed this video, make sure that you take a look at that one. Thank you so much for watching. I'll see you in the next video.